I'm Associate Professor Emily Stockings. I am the Program Lead of Smoking, Vaping and Mental Health at the Matilda Centre at the University of Sydney. So we surveyed 5,000 young people at baseline, and we found that firstly, their mental health symptoms among this sample were relatively elevated. So 20% reported having severe symptoms of depression, 20% reported having high levels of anxiety. And about a third each reported having high levels of perceived stress and also low wellbeing. And it's important to remember that these are young people aged just around 13 years old. The most interesting finding was that for young people who reported that they had ever used an e-cigarette in their lifetime, they had twice the likelihood of severe depression, and they also had lower levels of well-being and higher levels of stress. So it gave us an indication that young people who are vaping have elevated mental health symptoms. We're not sure yet what the direction of this association is. This is a cross-sectional study, so this is a moment in time. But we do know that there is a very strong correlation between low mental health, poor mental health, and e-cigarette use. We need to think about the way that nicotine works in the brain. So nicotine has two main effects. It is an anxiolytic drug. It reduces feelings of anxiety. And it's also a stimulant drug. So young people report getting a relaxed buzz from e-cigarettes. So it's possible that young people who are feeling stressed out or are feeling depressed are reaching for a vape to get that nicotine hit in order for a bit of a mood boost. The problem is this is very short-lived. So you get a mood boost and then it dissipates very quickly. Over time, your body adjusts, and the adolescent brain in particular is very neuroplastic. So it adjusts very, very quickly. And the brain goes, oh, yes, I liked that hit of nicotine. I'd like a little bit more, please. And so the brain upregulates its nicotine receptors. It has more mouths to feed. And so you need more nicotine to continue getting that same pleasurable feeling. This is the cycle of addiction. So it's quite possible that nicotine is acting on that same reward mechanism that is responsible for and is part of the mental health condition and the development of mental health conditions in young people. What was surprising in this particular study was just how elevated the mental health symptoms were at baseline. So these are Year 7 and Year 8 students. They are from a mixture of socioeconomic backgrounds. We've got a mix of metropolitan and regional schools, but otherwise they are largely representative of the Australian population. And we found that 20% of them were experiencing severe depression. And again, 20% with serious anxiety, and a third saying that they had high levels of perceived stress, and these are 13-year-olds. So that was surprising to us, that before we traditionally see the onset of mental disorders, which is around the age of 14 upwards, we're already seeing elevated symptoms across most of our samples. So that was a real surprise to us, and a concern, and sort of a call for action in this space. If a young person is vaping, it's highly likely that they've got other things going on in their lives. It's really important to approach a young person who's vaping without judgment. This is not about punishment. This is a health opportunity to go, hey, I can see that you're vaping. Tell me more about that. Approach with curiosity instead of jumping straight for the drugs are bad, don't do that, which tends to not work with adolescents. Rather going in with curiosity, let me be on your level. Let me find out why you're vaping. And then if an anchor is provided, such as, oh, I'm just so stressed, I don't know what else to do. That's when we can jump in and say, hey, look, I'm here. Why don't we workshop this together? So approaching vaping as a sign that a young person may need additional support with their mental health, or just in general with their coping, and reaching out without judgment to just be alongside them, be there to help them. When we think about responding to vaping, we need to consider mental health at the same time. This is the most important finding from this study. So we know that young people who are using e-cigarettes are twice as likely to be experiencing poor mental health. So this is something that parents need to consider, that teachers need to consider, school staff, others working in the community. If you can see someone who is vaping or is struggling with their mental health, it's likely that they are experiencing both at the same time. So what do we do? One of the main programs of work that we're working on at the Matilda Centre is building resilience skills and effective coping mechanisms among young people. So instead of reaching for that vape when you're feeling stressed, developing some healthy risk-taking behaviours that can give you that dopamine hit, but that also can give you positive benefits for your physical and mental health. These are things like going for a run, hanging out with your friends, being in the sun, taking a break from screens, resetting your brain, and then active team sports such as basketball, soccer, etc. All of these behaviours will give you a dopamine hit. And you get double for your buck, you get good bang for your buck because you're also getting improvements for your physical and for your mental health. So the whole idea around this program is developing effective coping mechanisms, assertive refusal skills, being able to identify when you're not feeling well, being able to identify when your friends aren't feeling well, and actively finding positive ways to address those behaviours. So what comes next for this study is that we are going to be following up these young people for 3 years. Half of the young people will be receiving the Our Futures Vaping Prevention Program, which is a dedicated vaping program that is designed to increase assertive coping skills, improve confidence in saying no to vapes, increase knowledge and empower young people to develop these positive coping skills. So half of the sample will receive this. The other half will receive standard PDHPE curriculum classes. So this is a randomised controlled trial. And at the end of the 3 years, we will examine and see how these young people are going and test if the intervention program had any effect on reducing the onset of vaping or reduce the prevalence overall in the intervention group. So we will be following them up, see how they go, but also tracking their mental health, their physical health, their other substance use at the same time.